So thank you everybody for joining our Tribal Leader Town Hall on COVID-19. We have a robust turnout for our call. We have a lot of people on, and I think that's a good demonstration of how important this is for Indian country. My name is Dante Desiderio. I'm the Executive Director for NAFOA, and we will be addressing the massive $2.2 trillion spending bill that was just approved last night by the Senate and expected to be approved by the House on Friday. The bill is less of a stimulus bill and more of a social insurance bill that's designed to get direct aid to individuals, governments, and businesses that are hit hard by this national shutdown to prevent the spread of the coronavirus. So the bill represents about 10% of the nation's GDP at $2.2 trillion. And there's going to be checks going out up to $1,200 for individuals with an additional $500 for each child. And it also includes about $150 billion in funding for states, local governments, territories, and tribes, and includes $350 billion for small business lending and additional $500 billion for lending for governments and large companies. There's likely going to be more. Phase 4 is already being discussed with the realization that this will get worse before it gets better. And we've invited members of Congress and directors of national organizations to talk through the main provisions that relate to Indian country. It's all of our hope to provide the best information we can and be helpful in making these funds and programs available to tribes as fast as possible. We don't have all the organizations on the call. But all organizations have been helpful in working together to try to make things better at home in your tribal communities. I also want to thank the intertribal organizations for their work in communicating the tribe's needs and the attorneys and lobbyists for their strong relationships with the members of Congress, and they've been very helpful during this time. We especially want to thank the tribal leaders and their professionals who let us know what their community needs were throughout this effort. So just a reminder, the language that we sent out in the broadcast is the version that passed the Senate. This still has to go through the House, and hopefully the Congresswoman and the Senator can give us a little more insight on what that looks like. But before we get on to today's discussion, we want to open this with a prayer. During this time, I think it's especially important for us to do that during this great imbalance. So we're lucky to have Governor Joe Garcia, the previous governor of Oke-Owingeh, and the previous president of the National Congress of American Indians. So Joe, do you mind opening us up with a prayer?
Dante, can you hear me?
Yes, we can, Joe.
Okay, with all due respect, I'm going to head in count today. No, he can't get more. But no, and that wing it to come for it. But we over here said over here, we moon. And what's on the Bimu? We also don't be here, we ain't married, we not taboo, we ain't married. In Gay Kaino, my Itan Hema, but no, it could go to it. By keyboard, the seafood is a canapo and down among. It don't know a hole. Oh, number one, but no, I mean, no big Hurimu, Quio said, oh, Rimu, I ain't a Erimu, the Epuyan, about help perimene, by ordering that fun that part perimene, in why money, and Banori, he poetry, the second at poetry, and body start on poetry, in Toan Namori, no, he can't demand, a rankui why, saying Waoriani in the Dapo. I don't know, the quail no more. The quail hunts and the quail cow no more. But okay, wing it or more. No, we're for a younger to my way, may. And but no, the seafood is a kind of point down on me. I don't know, we man if you go in, send direct to my hair and war. And buying that out of my painted it to my hair and war. We were saying why the army in our hurry that for. I don't know that. And because in the water, I want to go home. Ladies and gentlemen, I call upon the Great Spirit today to be with us, to bind us together, to lead and give us the wisdom so that we can take action to protect our people, to protect our lands, that in the past withstood larger forces than what we're facing today. But we stood our ground because of the spirit of our ancestors, the spirit of the great one. We have endured and we have remained successful. But these are still trying times. So I call upon the spirits of your ancestors, the spirit of the great creator, that we all stand together, that we put the weight on our shoulders, on all of our shoulders, so that every nation, every Indian nation across the land will benefit from all of the things that we will have to do, and that we will be successful. The spirits say that, and it is time to re-invoke the power of the spirit, the power of our prayer, the power of our culture, the power of our language, the power of our people. And together, we will do what is necessary to again instill the productiveness of this country as we've done in the past. As our veterans served in the military to protect this country, as our leaders stood their ground to protect their people, but also to protect the United States of America. And this is what we're asking for. And it is so much appreciated that the organizations have come together to do this, because it is who we are. And we will never die. We will not fade away. And so let's continue to work together with the federal government, with the states, the counties, for our people, our young ones, our elders, our unborn ones, that we will be successful in all these undertakings. And so the guidance is requested from the great creator. And more power to every one of you. And please relay these thoughts back to all of your people. And together, our spirit, one united great spirit, will be the overcoming power upon which we will depend to overcome all of these things that are happening. So with all of that, I leave you kindly, and I leave you with respect. And I thank you so much, and Dante and Daireen, for asking me to be a part of this. I know it's taken a little while, but I think it's duly required and duly needed and duly proper. So with all of that, that translation of what I had said earlier, may the power of the Creator be with all of you and all of your people. Kundawaha. Thank you very much.
Thank you, Governor Garcia, for those good words and things to remember during this time. So we're going to move to the action in the Senate. As most of you know, this bill passed late in the night, late last night in the Senate, and we're honored to be joined by Senator McSally. She has for those of you who don't know, Senator McSally represents Arizona in the United States Senate. But before jumping into the political arena, she served in the Air Force and was a combat veteran and rose to the rank of colonel, which is very impressive. She's a member of the Senate Committee on Indian Affairs. And she had a very strong effort, which we want to hear about in partnering with Senator Daines on putting forward a letter to Senator Mitch McConnell, and a dear colleague letter that really supported Indian country in the Senate debate. So we're appreciative of those efforts, and we're especially helpful in having tribes secure the $8 billion in stabilization funds for governments and IHS funding for over $1 billion. So we want to hear more about your involvement in the Senate difficulties passing the bill. So thank you for your efforts. Indian country really appreciates it. So Senator McSally?
Absolutely. Well, thank you so much, and thanks for that wonderful prayer. We voted on this at 11:30 last night, hopped on a plane. I just landed back in Arizona. But I want to walk through the provisions of this bill that we worked on in the Senate in a bipartisan way over the last few weeks. It sure would have been better to pass on Sunday. Delays certainly are not helpful while people are fighting for their lives. Our frontline healthcare workers are fighting for needing this protective equipment, protective gear, and every day people are losing their jobs, their livelihoods, and the economic impact of this unprecedented pandemic. But we are all in this together, and I know there is a lot of fear and a lot of uncertainty out there, but I truly believe we will prevail. This is not just a federal effort. It's going to be an all of society effort for all of us to get through this and save lives, support those on the front line for everything they need to save lives. What we call flatten the curve, do our part to flatten the curve so that our healthcare systems do not become overwhelmed and we're able to save lives, and we've got the equipment and the treatments being tested, but also that we provide immediate, and this is the important part, urgent and immediate economic relief to people out there. So we had, I want to go big picture on the pillars of this legislation, and then specifically how this impacts Native American tribes. We have 22 in Arizona. I'm honored to be on the Indian Affairs Committee and fighting for all of you. So our main objective, because you know it's the federal government and it's not fast. So if you're trying to do something new, and we saw this actually in the phase 2 funding flow where CDC was providing some funding to tribes, but because that wasn't something usual, it just took a while for that to happen. So we wanted to make sure we had mechanisms to quickly get money to people as quickly as possible, get money in their hand, in their checking accounts, checks in the mail, so that they could get food on the table. They could meet some basic needs here during this this pandemic and the impact that it's having. And so one key element of this bill is $1,200 per person, $2,400 for a couple, $500 additional per child, check in the mail from the IRS, as long as you made below $75,000 per person last year. It's phased out up to $99,000. So as a couple, that's $150,000, which is way above, the median income. So many people, many tribal members are going to benefit from this immediate relief that we wanted to get swiftly out through mechanisms, the same ones that were used in 2008. So that's the first piece. And we wanted to make sure on any of these pillars that there was parity and that tribal communities were benefiting from how we were trying to address this holistically. So that applies to everybody. The second piece is if somebody is unemployed, if they were laid off, many people have been laid off already. We've boosted unemployment insurance significantly for 4 months. So for example, in Arizona, the maximum anyone can get per week is $250. We plus that up by $600. So that's $850 per week for this 4-month period to help people who need that assistance. Again, it's an all of the above, make sure we're getting resources quickly to people so they don't fall into more insecurity, food security, health insecurity while we're addressing this issue together. So all those who are laid off from Native American communities will also benefit from that. Those are different numbers in each state, but in Arizona, that would be $850. So that's the second piece. The third piece is we'd actually prefer, though, that people stay connected to their employer to the max extent possible, but so many businesses are shutting down. And as you know, casinos shut down, hotels shut down. We're talking revenues going to zero. This is unlike any other economic downturn we've seen in my lifetime, certainly in a very long time, really ever in its uniqueness. And so we wanted to quickly get money to businesses so that ideally we can keep employees connected to employers. We think this is very important for obviously pay to be flowing to employees. Ideally, it's better than standing in line to get unemployment benefits, which often comes with a delay in processing, especially when the system is overwhelmed. And it's also important just psychologically, as people are dealing with the fear for them and their families, that if they could stay connected and not be wondering what's going to happen when this is over, are they going to have to look for another job? What is this all going to look like? So it's a societal issue, it's a psychological issue. So that what we did is we thought, what's the fastest way to get money to small businesses? Instead of standing in line for a government SBA disaster loan, which is what we often do after a natural disaster, we just thought that's just not fast enough. What we're using is existing infrastructure with banks and credit unions around the country. Initially, there's a subset of all banks and credit unions that are a part of the Small Business Administration 7A program. I don't want to bore you with these details, but we want to use existing infrastructure, and then as quickly as possible, Department of Treasury is going to give guidance to all financial institutions, all banks and credit unions, for them to be able to also participate in this. So the vision was that employers below 500 full-time equivalent could go into the bank, and I know there's a lot of challenges for, in tribal areas for where is the closest bank, but we didn't want to centralize this to one federal bureaucracy, so we wanted to distribute out to existing banks. And if they are using the money for payroll and for overhead, utilities, and other things, it is a loan, quote unquote loan, but it will be a 100% forgiven loan as long as it's used to keep people on the payroll and keep kind of the overhead. One way it was described to me is by a small business was, we need to hibernate right now. We have no revenue, I have no business, nothing happening, but we don't want collapsing of this infrastructure. And so this is a critical part of this legislation to keep employers connected to employees by being able to get access to these forgiven loans. So in the end, they will essentially be a grant for keeping people on payroll and for overhead. When we first saw the legislative draft from the Small Business Task Force working on this, we were concerned that casinos and hotels under 500 would not, this wouldn't apply to them. So we wanted that parity. So this was included in my letter with Senator Daines. All of these things were in our letter, but we're also working around the clock and behind the scenes, senator to senator, to make sure that specific language was added in that section so that it was very clear that there's parity for tribal entities of 500 employees and below. And I'm happy to report that we successfully got that language in there, and this provision will apply. There's a third element of for businesses or entities that are bigger than 500 employees. There's this $500 billion that is loans, trying to just provide liquidity. Cash flow is the issue for many businesses, to try to incentivize them to keep people on the payroll to the max extent possible until we get on the other side of this and we defeat this disease, which we will. We will defeat this disease and we will prevail, but we needed to provide this support, this cash flow support. So this other $500 billion, we also made sure that the language that was in there was going to allow for tribal entity for casinos and other tribal entities that are over 500 employees. This bill is a significant influx of resources to our frontline warriors. Look, I've been to different kinds of war myself, deployed 6 times. People are always thanking us for our service, which I'm grateful for. But in this war, it's our nurses, our doctors, everybody working at our healthcare facilities, keeping the lights on, keeping things running, our first responders. They are these heroes on the front lines, and they need right now testing kits, masks, gowns, ventilators, hospital bed capacity increase, you name it, across the board. You've seen, and we've had many conference calls with our tribes in Arizona, and we know across tribal country and across the hospital infrastructure and healthcare infrastructure in America, these supplies are strained. So we wanted to make sure those resources flowed specifically for tribes. We've secured $1 billion for IHS. This is really important money to flow down. But I also want to make sure, and I know you'll talk about it in this call, we've been on several calls with the head of IHS and our local tribes and FEMA and others to make sure that each tribe understands what's their best path for them to get access and make their requests known for what they need. I'll quickly just say that comes down to kind of an all of the above strategy. Work your normal supply routes. Many of those are choked out. Work with your local counties and states because they all are in setting up emergency centers to make sure they know your needs. Work through the normal routes to go through the Oklahoma City National Service Supply Center. And there should be tribal liaisons in states that are helping to make sure that, whatever's the fastest way to get those supplies to you will happen. That the coordination is so important, and we're helping with that coordination in Arizona. The last piece I want to talk about, which I went to the mat for, was this $8 billion. When we saw that there was going to be some sort of state stabilization fund that was focused on government entities, states and cities, we certainly first wanted to make sure that tribes were included in that, but we felt very strongly, and I worked with Senator McConnell's office in the White House, just not coming off how important it was to carve out significant money for tribes that would be protected for them. This overall fund is $150 billion, and I'll tell you, there was a lot of, behind the scenes. I won't bore you with all the knife fighting that had to happen here, but I was literally presiding on the floor of the Senate the night that the deal was announced, and this fund was still in jeopardy. Somebody out there, I don't know who it was, but they kept trying to lowball it or cut it or get rid of it. And I just, I was sitting up there, so I couldn't make phone calls, but I could text. So the person I was working with at a very high level in the White House in McConnell's office, I texted him. McConnell's office guy came down and talked to me on the floor of the Senate. I told him, we got to get this money for the tribes. Like it has to happen. And I did the same thing with the White House. And they came back in and reported to me that we had secured in the last part of the negotiations, because of that final push, $8 billion set aside. This is 5.3% of the overall fund for states and cities and tribes. So this is a big deal. And I'm glad we were able to deliver on that. And we need to get this entire package quickly through the House as fast as possible on the president's desk, signed into law so that money can flow to all of you. There's other elements in there on rural broadband, and there's so many other pieces with telehealth, and that doesn't work great if you don't have connectivity. So there's money that's flowing in many other pockets, but these are the main ones. And I wanted to make sure, and those we're working with, that as this package got finalized, as many of you know, sometimes, especially when things are thrown together quickly, they leave the tribes out. Oversight by mistake or lack of advocacy, whatever it is, I don't know. I've only been in the Senate for a year, but we were able to make sure that this language included all of you. There's parity there. There's $1 billion to IHS. There's $8 billion set aside for the tribes, and we are all in this together. We're going to stay communicating with you to make sure we know what your needs are. If we have to do, as we're working on a phase 4. And with that, I will say God bless you all. I'll be listening on the call, and my staff will be listening as well, and we're here to help.
So, Senator, if you don't mind just taking a question here, I think
Sure.
there is, and thank you for that, and thank you for going to the mat for us. I think that's just amazing to hear, to have champions in the Senate. But what happens now, and what I mean by that is the Senate's going out until April 20th, I believe. What happens with phase 4? Is it being planned now? And I think some of the participants on the webinar here want to know how they get their benefits. Do they need to file a tax return for that check coming out?
Yep.
How immediate is that going to happen? I think there's a lot of anxiety about making payments now.
Yes. So obviously, first we need the House to just pass this by voice vote. They don't need to bring everybody in. That would not be smart health-wise for 435 people to be flying in. And look, they may not love every part of it. We thought the previous bill was imperfect, but it was important to act urgently and to show unity. We passed that bill 96-0. So I just encourage House to get it done. So what the Treasury is telling us, when this happened in 2008 time frame, it took them a long time to get checks out. This time we are pushing on them. They realize how urgent it is. They are saying once it's signed into law, 2 to 3 weeks. I think Secretary Mnuchin said yesterday 3 weeks. He's been saying to us 2 to 3 weeks. He's trying to expectation management to the public. And the way I understand it is, if somebody filed their taxes electronically last year, so we're not talking about this year's taxes, which are delayed until July. Last year's taxes, if you filed electronically and they have your bank information, they have the ability to put it directly into your bank account. That will actually come faster. If you did not file electronically and they don't have that information, they're going to be sending you a check. I've already asked the question, some people the check may not find them right away because of housing instability or other things. And so they have to have some sort of mechanism for people, if their check doesn't find them, how do they find their check? But they're saying 2 to 3 weeks. We'll keep you in touch. You don't have to file anything. And it's those income limits that I just passed on to you. Secondly, phase 4, look, we're out of session for a variety of reasons. One being, this is a pandemic, and we also need to ensure that Congress is not being irresponsible about flattening the curve. 25% of the Senate or more is probably in the vulnerable category here. So no one's immune to this. But we still have responsibilities. I mean, we have to take risks if needed to support our constituents. So conversations will be ongoing for phase 4. If we can coordinate those virtually, there are ways for us to bring a few people in if things need to pass and do it by unanimous consent. We would need total consent to do that, where nobody would be standing up to object. So there are ways to do this in the Senate and the House without dragging everybody back in. We've got to execute and implement phase 3 now. This is a massive, $2 trillion, but we'll be gathering feedback as it's being implemented as to what else needs to be done in phase 4. And we will not let the fact that we are planned to be recessed for a few weeks while we're also doing our part to flatten the curve stop us from continuing to help this country get through this pandemic.
Okay. Well, Senator, I know you were kind enough to join us right after your flight landed there in Arizona. So thank you for coming on. We really appreciate it, and thank you for your work. We have a lot of other questions, but hopefully we'll get to those as we go through our town hall meeting. So
absolutely. My team's on the line. I'll be listening as I drive home here, but I won't be talking. It's obviously got to be safe on the road. But we'll be listening. We're here to help. Whatever you need, please stay in touch with us. And, we're happy to do whatever we can to help implement everything that you all need as quickly as possible.
Great. Thank you. So you can tell by Senator McSally's comments that there was a lot of discussion and heated conversations about where Indian country landed in the Senate. So we're now going to go over to the House side of things and introduce Congresswoman Horn, Kendra Horn from Oklahoma. So the Congresswoman is from Oklahoma, where she represents the 5th District, which includes Oklahoma City, and it includes or is surrounded by a number of Oklahoma tribes. And just for levity, we'll give anyone $100 million from this phase 3 if you can guess the name of the mascot from the University of Tulsa, where the Congresswoman went to school. So Congresswoman Horn has been a champion for Indian country during this historic time in the country, and definitely a historic time in Congress. So she's certainly not the only one, but her efforts stand out along with others like Deb Haaland and Congressman Cole. We're hoping to hear your insight, Congresswoman Horn, on how the House will vote, and also talk us through some of your efforts on the House side. So welcome, Congresswoman Horn.
Thank you so much, Dante, for the invitation, and thank you to everyone for participating in the call and for allowing me to be with you today. And Governor, thank you for that prayer, opening prayer. It is such an important reminder at this time for us to continue to ground ourselves back in community and focus and what we need, as well as in the practical measures that we have to keep coming back to that. And Dante, I am going to be very curious to see what the guesses are about the mascot of the University of Tulsa, where I went undergrad, because it is, as I think you alluded to, not something one would expect. So I will, I'll leave that maybe to the end and see if anybody guesses it. But again, I'm grateful for the opportunity to visit with you all. As I no doubt know many of you are aware, Oklahoma has 39 tribes, 38 federally recognized tribes, and I have a number of tribes in my district that overlap at least parts of it, and one of the largest urban Indian health centers in the country that is a hybrid model. So we have so many needs from our tribes, and we need to make sure that we are taking care of them. I'm glad to have great colleagues like Congressman Cole and Congresswoman Holland and Sharice Davids and so many others to help advocate for making sure that our tribes have access to the supplies they need. I think that Senator McSally covered a lot of the detail about what was in this last bill that the House will take up soon, and I'll talk about that in a moment. But I want to really emphasize the work that we are doing, have done, and I think continue to do to ensure that we're advocating for our tribes, IHS, and to make sure that everyone gets the resources they need. And I think we have made a great start in that, of helping my colleagues in the House, as well as I know members of the Senate, understand the critical need for us to ensure that Native Americans and tribal nations are included, and that all of Indian country is taken care of. So a few things from these past few weeks, because as was mentioned, this was the third measure that we have passed, or that the Senate passed, is the third bill to address this unprecedented health crisis and the resulting economic impacts. And we have much more to do. As you were no doubt aware, that first $8.3 billion funding package was primarily focused on health research and getting money out to the communities. But one of the challenges is that we were finding that our tribal communities were not getting the funds and support that they needed. And there are several pieces to this puzzle. One is making sure that IHS and tribal health authorities and urban Indian organizations, as well as tribal nations, have direct access to the strategic national stockpile. And we have been working on that. And on Monday, I introduced a piece of legislation in the House to make sure that all of these different entities get access to the strategic national stockpile, because we cannot be leaving our communities behind. It is critically important at this time that we get the resources out to our healthcare providers and those people who are doing the critical work on a day-to-day basis. And we will continue to advocate on that, because currently the tribal access to the stockpile has been limited and is not guaranteed in statute. Whereas states and municipalities and public health authorities do have access to that. So we're going to continue to advocate for that, to make sure that tribes and IHS and Indian health authorities get access to those critical resources that they need to take care of the health of their communities. And I think that goes to the other pieces about making sure that the tribes are included in the funding. As Senator McSally mentioned, there were $8 billion in the package that the Senate passed. And there's also, as I understand it, $1 billion that will go to IHS. And we will keep fighting for that, working with my colleagues in the tribal caucus and the Native American caucus in the House. We have been raising that concern and sent a letter as this third package was being negotiated to fight for tribal health communities getting the resources they need from these previous pieces of legislation because the funds and the support were coming too slowly, and fighting for $120 million to go to our Native American communities and health providers. And so I want to briefly go over just a couple of other things, and then I'd be happy to answer any questions. And about what we're doing and what I think moving forward. I'll talk about the House, and I believe that we will see quick action in the House. I believe that we will see the House come together to continue this effort, because one thing we know is that this virus doesn't particularly care who you are or where you're from, and it doesn't distinguish between any type of partisanship. So we have to continue to come together and make sure that we're advocating the voices of all of the communities, and that the tribes get all the access they need. And we have demanded that, I've demanded that we take action to address government revenue shortfalls for essential services for the tribes, the same as we are considering for the territory states and local governments. Because that is critical, and that I think this bipartisan deal shows that there is a voice for Indian country, and we will continue to fight for that, knowing how important it is for all of us, because we're all in this together. And I think that there will be continued work moving forward, that we have to continue to lift up the voices of Indian country and the unique needs and challenges that can easily be overlooked if we're not there to champion it. But I will continue to do that. And then I want to address two other things quickly, and that is access to education, housing, and food distribution, and other related issues that also impact Indian country, that especially in this time when many people are home, they are disconnected from their communities physically. It is incredibly important that we make sure that those people who are the most vulnerable have the access to the food, to the incredibly important access to funds to keep lights on. But one of the things that we have done, that I've been working on in the House, and I think we'll see hopefully in the next package, is ensuring that communities have access to water and power. We raised the issue of water shutoffs in Oklahoma City with the public utilities, and got commitments from the utilities to halt any shutoffs. And we are continuing to advocate for water and utilities support in these next coming days, because it is so important, because we know one of the chief recommendations of the CDC is that we are able to wash our hands, and as people are at home, making sure that they have power and water as much as possible. I know this is different depending on different communities, but we'll continue to work on that. And finally, I'll say I do think that the House will move quickly. I am at home in Oklahoma and have been working remotely. Thankfully, we do have access to technology that allows us to continue these efforts. So they will not quit. We will not quit, and are fighting for our communities. But I'm in quarantine for a couple more days, because I was in contact with one of my colleagues who has tested positive for the coronavirus, and making sure that we're doing everything we can to model the behavior that we need to flatten the curve, to keep our community safe, to give our frontline workers and our healthcare professionals, as well as those who are in critical service industries, the people that are working in grocery stores, the workers that are making sure that our gas stations stay open so we can keep the food supply going. All of those things are critically important. And finally, mental health and access is a critical piece of access to health. So we've been advocating for making sure that there are access to telemedicine services and supports for those items, and an honor to work with and be a voice to advocate for Indian country, and glad to be here with all of you today. And with that, I will turn it back over for any questions.
Yeah, thank you, Congresswoman, and thanks for that background on all of the different the things that you've been involved in on this effort. I think there's still some questions on what happens next. I know we heard some concern over interpretations of eligibility, and my impression is that this bill, this legislation, is really designed, especially on the definition side, to be as broad as possible. So is that your impression, and is there an effort that we can start working on to make sure that we're working in the agencies and getting our congressional support behind us to get the most generous interpretation of that?
Yes, Dante, thank you for that question. Yes, it is the intention to make the interpretation be as broad as possible. Though I do think that we still have work to do to make sure that our agencies understand the needs of our tribal communities of Indian country, IHS, and the other impacted communities. A few things that are going into this. One is, as you may imagine, the speed at which things are moving is, even though many of us I know have been frustrated at varying points when it seems that things were being stuck. The speed at which things are moving means that we are continuing to get answers moment by moment as we understand how these things are going into place. So I would recommend communicating with the agencies, communicating with your members if the agencies are not being responsive, making sure that we are aware of what is happening so that we can also go to bat for you and we can lift this up to agencies and work together with our tribal nations to make sure that we're being good partners and respecting your sovereignty and making sure that at the same time we are upholding every single aspect of what we can do as a federal government and our trust responsibilities to make sure that we are being good partners and advocates for you. The more you communicate that with us, the better off we are. And I know that so for so many tribes, the critical impact of tribal businesses on the ability to provide services to tribal citizens is critical, and that's why I'm grateful we were able to get the $8 billion in this package. But I know there is more to do, and if you are finding your tribe or your organization running into roadblocks, reaching out to us to let us know and help us understand how we can work with you is important, and what we can do to help take care of our individuals as well as organizations and service providers in Indian country. The more we understand, the more we can be better partners, and we are here to work with you. Both, I will say this for myself personally, as well as my team, and we are here to help fight for making sure that Indian country gets the resources that they need and to protect our Native American communities.
And thank you, Congresswoman, so much for your help in this throughout and the offer to help us going forward with the distribution of programs and funds. And also thank you for your work on the census. We appreciate it. So we're going to go now to talk through some of the sections. We've divided this town hall meeting up into 3 sections: governance, healthcare, and economic. So we're going to hear on the governance side of things. And before we jump in, I just want to remind the panelists and some of the others on some of the organizations that we have a whole queue of questions. If we can start answering those questions, if you all know those, that would be great. But we're going to jump in and hear from Kevin Alice, the Chief Executive Officer from National Congress of American Indians, who's played an instrumental role in gathering comments and things together and pulling the organizations and others together in this effort. So Kevin.
Dante, thank you very much. Good morning, good afternoon to everybody. Glad to have you here. First, a couple of thank yous. I want to thank Head Councilman Joe Garcia from Okewinge for opening up this important meeting for us. NCAI is very lucky to have had Joe as a president. Joe currently sits as a member of our executive committee, and his wisdom is extremely valuable to me, to my team, and to all country, Indian country. So, Head Councilman Garcia, thank you very much. Also want to thank Senator Martha McSally. We know you were in the trenches fighting for us earlier this week. We greatly appreciate that. Your assistance, along with Senator Daines, was pivotal in getting some of these provisions through. We knew what was happening in real time. And I can tell you, Tuesday afternoon, when I was sitting alone in the Embassy of Tribal Nations, managing this project and interacting with many of the folks that we had out there touching the Hill, they were following your lead, and we appreciate what the two senators did. And I also do have to mention, on the other side of the aisle, Senator Tom Udall has always been a great champion for us and worked extremely hard to make this happen as well. Congresswoman Horn, we appreciate your leadership and your support for us. You know, it means a lot to us. You understanding our communities is important, and we thank you. And on another note, I'm really looking forward to seeing Captain Kane in the next upcoming Avengers movie.
We have a winner.
Nice work. Yes, sir. The Golden Hurricane.
Where we go. Anyway, we'll kick into some business. As we all know, there is nothing more important in any country right now than addressing this unprecedented health crisis. Because of the economic impacts of COVID-19 across the board throughout the country, all governments we see are experiencing a revenue shortfall, and they're experiencing this shortfall in the face of increased demands for government services. But tribes are in a really unique position because a complete disruption to funding for their governments is devastating. Tribes don't have a tax base, and they rely upon their tribal businesses to generate revenue to fund essential government services. And this legislation and getting this through and getting provisions in this legislation that recognizes that and addresses that couldn't have been more important. Tribal industries, as we know, contribute $50+ billion a year, not only to tribal governments, to the American economy. And COVID-19 pandemic has devastated Indian tribal governments right now by threatening the ability the ability for these governments to continue providing basic governmental services like healthcare systems, public safety personnel, schools, housing, and families. And so these folks on the phone worked extremely hard in doing what they could to safeguard that. Knowing how important this was, and knowing that we're facing a situation that we have never seen before. We were looking at a piece of legislation and development over the weekend and late last week that we will probably never see anything like this again in our lives. NCAI and our partner organizations had to be on the front lines in making sure we did the right thing and that our leaders did the right thing. So what NCAI did was we took kind of a leadership role, a clearinghouse role, if you will, because somebody had to manage the enormous amount of talent that we have in Washington, D.C. and around the country that represents our tribal members. We had to organize that in a way that made sense and was unified and made it easier for our champions on the Hill to get stuff done for them. What we did is we convened a call early last week and invited everybody who was interested in participating in a grant program. And what we did is we had them develop a list of policy priorities in no specific order, but just what do we need to consider in this particular bill? They all submitted what they thought was important. Many of them were the same, some of them were different. What NCAI did inside the House then was to categorize those policy priorities in three groups: economic development and employment, healthcare, nutrition, and education, and then tribal governance and housing. And once we did that, we convened a second call and had people volunteer, professionals volunteer to participate in one of those three groups and work on vetting out and fine-tuning each one of those policy priorities and then drafting bill language, legislative proposed bill language for each of them, so we could compile it in 3 very simple and concise documents that we could forward to the Hill, and then launch a campaign that would champion each one of those. Our partner organizations were enormously valuable in that, and no one can take credit. Certainly NCAI can't take credit for this alone. All of us worked together. We only managed it to make sure that the messages got out there. And what you heard from Senator McSally and the Congresswoman is that, you know, great things did happen. And in this third COVID-19 bill, the CARES Act, I'm just going to highlight some of these you've heard already, some of you haven't. Some of them I'm going to defer to speakers that will follow to talk in more detail. But this is what we saw come across the finish line in the Senate. An $8 billion relief fund that will allow tribal governments and tribally owned entities to be able to address and face revenue declines. Tribes' eligibility in the Small Business Act Section 7A Paycheck Protection Act that will provide 100% federal loan guarantees up to $10 million to cover costs like employee salaries, paid sick and medical leave, mortgage and rents, and employee health insurance policies. Reimbursement for unemployment insurance, reimbursement for half their incurred unemployment benefit costs. Those are for reimburser tribes. Federal education waivers. We'll hear more about this and some other things from Diana Coyer from NIEA. Authorizes the Department of Education to waive provisions of the Elementary and Secondary Education Act for all BIE schools, including Tribal 638 contract schools and Tribal 297 grant schools. Extends the Special Diabetes Program for Indians at FY 2020 levels through November 2020. Indian Health Services provides $1.032 billion in critically needed resources to support tribal health systems during the pandemic. Bureau of Indian Affairs will get $453 million to provide aid to tribal governance that supports welfare assistance and social service programs, to expand public safety and emergency response capabilities. BIE will get $69 million for response needs at BIE funded schools. HUD Office of Native American Programs will receive $200 million for the Native American Housing Assistance and Self-Determination Act block grant programs, and $100 million to Indian Community Development block grant to respond to COVID-19. Tony Walters will talk a little bit more about that. Food distribution programs on Indian reservations, enormously important, provides $100 million to the program that provides USDA commodity foods to low-income housing. Colby Dern will talk a little bit about that. Also, the Older American Act Tribal Nutrition provides $20 million for the delivery of nutrition services. And finally, Indian Child Care Development Block Grant provides between 70 to 96 million for Indian child care programs that serve low-income families to help defray the costs because of the COVID-19 response. All of this is critically important, and were all action items that our large group, broken into 3 work groups, advocated tirelessly over the past week. I really have to also thank our tribal leaders out there. These folks are boots on the ground and dealing with this every second of the day right now. And this is nothing that they anticipated, even as short a time period as 3 weeks ago. They've done a phenomenal job so far dealing with the crisis and also relaying information to us that we could use to and filter into our messaging as we continue and continued to stress upon our champions to make sure these things got into the bill. We encourage all tribal leaders out there, continue to reach out to us, continue to reach out to our tribal organization partners to make sure we have the real-time information we need to make sure that message gets to where it needs to go. And just so everybody knows, the work is not done for us. We are now entering phase 2. We already have calls scheduled for this afternoon, each of the 3 work groups, on building out a strategy in very short order that will ensure that everything that Congress intended in this legislation is properly implemented and distributed out to Indian country, whether it be a directive or whether it be a service or whether it be funding. So just as we had a strategic approach to get stuff in the bill, and in future bills, by the way, we have we're going to have a very focused and comprehensive strategic approach that now focuses on the administration to make sure they do what they've been asked to do. So on that, I'll stop there, and I'm going to turn it over now to Colby Duran, who is the director at the University of Arkansas's Indigenous Food and Agriculture Initiative, to talk a little bit about what kind of food nutrition programs will be aided through this legislation. Colby?
Hi, thank you very much, Kevin. And thank you to Dante and NAFOA and NIHB, Stacy, and Sherwin for all your work on this and coordinating all these efforts. My name is Colby Duran. I'm the director of the Indigenous Food and Agriculture Initiative at the University of Arkansas. Just a little bit quickly about us. We work to support tribal governments, tribal food producers, and tribal food businesses, and really supporting and empowering food sovereignty and really putting the tribal sovereignty and food sovereignty, looking at law and policy analysis. Through that, we're also the research partner in the Native Farm Bill Coalition, which is a coalition of about 170 tribes and many tribal organizations, several of those that are included in these efforts as well too. Just wanted to go through a little bit about what's included specifically for some of the nutrition programs in this piece of legislation. As Kevin mentioned and Congresswoman Horn mentioned, one of the larger items was the $100 million for the food distribution program on Indian reservations. Folks are probably very familiar with that program. It's the commodity food program that provides both fresh fruit and vegetables, commodity food, frozen meat, and also traditional foods to low-income households across Indian country. It serves about 276 tribes. Included specifically in this legislation that is broken out for that $100 million is $50 million for food purchases to handle some of the additional participants and the need for food that we're seeing currently, and also $50 million to address facility improvements and equipment upgrades to not only store the food, but also be able to help get that food out to folks that need it most. I'll be going just kind of a little bit more in depth in that in a second about what that means, what we're seeing, and how this support will be helping on the ground with some of the immediate impacts that FDIPR is seeing with the COVID-19 emergency response. Additionally included for nutrition funding is $20 million for the Older Americans Act, specifically for Native American nutrition grants. A lot of these are the Meals on Wheels and also providing food to elders throughout Native communities. So that additional support will be very helpful. I also wanted to flag, because it's an important program throughout Indian country, is that there is an authorization of funding for the SNAP program, or the Supplemental Nutrition Assistance Program, which is the food stamp program. This is just a straight authorization. In the next couple of days and weeks, in the 4th and 5th packages that go forward, there will be efforts by a lot of anti-hunger organizations like Mazone and FRAC and others looking to be able to try to increase this by 15% based upon the need they're seeing in the SNAP program. Additionally, specifically with nutrition, there's $8 billion held for child nutrition programs. This includes WIC and some of the school lunch programs as well too that are providing essential food services to those participants, particularly during this time. Just to kind of talk about what the impacts are we're seeing and really where the $100 million is going to help the FDIPR program. Some of the data and concerns that our team at IFAI and our research director, Aaron Parker, has kind of put together in our work with the National Association of FDIPR. Just in the survey that we did quickly, we're seeing already an average of an 11% increase in new participants across the board. And that's kind of a low, probably a lower estimate. And we know that some sites are seeing at 50% or more increase in people that are coming in with new participants, and also folks that have historically been participants. And we know that number is going to be increasing substantially as a lot of tribal governments and businesses are closing and folks are out of work. We're also seeing a strong increase in what's called the take rate and the foods that are available for folks who are on that program. And now this is kind of a direct response, not only to the additional needs and additional people who are coming to be served by the program, but because of the lack of food within grocery stores that's available. So the items that folks might be using their limited resources on to purchase at grocery stores, they're looking to the FDIPR program for those important items. A third impact that we're seeing currently is supply chain and inventory ordering issues from the national warehouse, where there's items that currently aren't available or aren't being sourced. A lot of these are starting to see things happen with fresh fruit and vegetables, other frozen vegetables, and meats as well too. So there's concern about some of the supply chain being able to keep up with the demand that we're currently seeing. Also, there's a lack of some of the existing infrastructure to handle new people in food storage. Many FDIPR sites are almost at capacity with their storage and refrigeration and freezer units as well too. So there's a need to build this out to house the food that's going to be able to help the folks that are going to be coming onto this program. One thing I wanted to flag for a lot of folks is that USDA does have a food disaster assistance program that tribes are eligible for, as well as FDIPR sites are eligible for. We know that several tribes have applied for this. This will require additional support to help increase the warehouse inventory, as there will need to be a place to kind of store these foods. So hopefully these funds can help and support this. Going forward with implementation, when the House votes on this and this ends up going to USDA, there's a couple of key points that we wanted to kind of address. First, the money we know will be going to the Food Nutrition Service, which oversees this program. And again, FDIPR is a tribally run program. So the process is a little bit to be determined right now. We do know that in the conversations with FNS that they are open and they're going to be doing weekly calls with the FDIPR program managers, with the National Association and tribal leadership to talk through things that are happening on the ground. I was just had a call with USDA today where they talked about some of their willingness to not only do this, but to help out any way we can. And that goes to the second point, really, of supporting as much administrative flexibility in the program as possible. With so many new people coming to the program and needing to be served pretty quick, with some of the challenges with having limited staffing and availability, the FDIPR sites need to have as flexible a process as possible to certify people and to get food into their hands. And so we hope that that expedites not only getting people on the program, but expedites the funding. There also needs to be some funds to help be able to cover the administrative costs. So hopefully some of the money can support that, and ways for USDA to waive the tribal cost share in the program, which is 20% right now. That's hopefully something that they can do administratively. Further, there is another commodity program mentioned within this language, so we want to make sure that FDIPR not only has priority access to the $100 million, but also that the foods that are bought for FDIPR must go to the FDIPR programs. It's an issue that we've seen in the past with some funding, so we want to make sure that this money not only purchases the foods, but gets the foods directly to the FDIPR programs and participants. And then lastly, with social distancing and with FDIPR having about 42% of their households having an elder over the age of 60 in them, we know folks that are in more of the vulnerable categories are going to need to have increased delivery and also other service options like prepackaged food. So the support to be able to provide those is going to be critical. Glad to talk through any questions or any outreach that folks have on this. We have more information on our website at indigenousfoodandagricultureinitiative.com. You can also email and reach out to me directly. My email is cduren@uark.edu, and be glad to answer any questions that folks have when we get to that part of that program. Thank you.
Great, thanks, Colby. Colby and the following speakers, Diana and Tony and Stacy and those that follow, were all part of this effort, and their expertise was really important. The whole effort included 18 tribal organizations and 106 lawyer lobbyists in DC, and these folks were very valuable. I'm now going to turn it over to Diana Knoyer, the Executive Director of the National Indian Education Association, to talk in a little more detail about the educational pieces, the education pieces that are in this legislation.
Thank you, Kevin. I just want to say hello to everyone, my relatives, friends, and colleagues. This has been a trying time, I know, for all of us at the local level, as well as all of our tribal leaders, our community members, and our national organizations. I'm reading PowerPoint today, and I just want to give a shout out to my legislative team and all the education advocates that have been working hard, as Kevin has said, during these really unusual, unique times for all of us. And now as we get into the education conversation, how are we taking care of our students, not just their academic needs, but their health and their emotional and their social needs? So I will start with the next slide, please. So overall, Bureau of Indian Education operations is $69 million. These are for programs through September 30th, 2021. Not less than $2 million shall be for tribal colleges and universities. In considering this package, $78,000 is for the Institute of American Indian Arts and our Native Culture and Arts Development. The Education Stabilization Fund, a little over $153 million. 1/2 of 1% of that is a tribal set aside for programs that are operated or funded by the Bureau of Indian Education, and this does include tribal colleges and universities. Another billion or so are for parts A and B of Title III, which this includes minority serving institutions, tribal colleges and universities, Native Alaska, Native Hawaiian serving institutions, and Native American serving non-tribal institutions. Additionally, museums and library services, $50 million to expand digital network access, purchase internet accessible devices, and provide technical support. Additionally, matching funds, which are required by states, tribes, libraries, and museums, are being waived at this time. BIE and tribally controlled schools are eligible for the Department of Education streamlined waivers for statutory and regulatory requirements specifically related to assessment, accountability, reporting requirements, in addition to other grant requirements that are in regards to restrictions for carryover limitations or individual requirements under student support, academic enrichment programs, also including assessments and accountability. Next slide. The higher education waivers also maintain waiving non-federal matching share requirements for campus-based aid. We're assisting making sure that students with unexpected incomes are supported through the Supplemental Education Opportunity Grant. Any kind of work study that our students are getting will be continually paid. Students are excluded for subsidized loans during this time, or any loans that are part of the semester that is not completed due to COVID. Excluding semester not completed for Pell Grant, so our students receiving Pell funding will still receive their dollars. Waiver requirements on amount returned for loans or grants by institutions and students based on student withdrawal due to the emergency. A waiver for calculation of satisfactory academic progress. Additionally, the Secretary shall suspend any payments due for student loans for 6 months, and interest shall not accrue for the period of the suspension. Waiver authority and reporting requirements for institutional aid to ensure institutions, including our TCUs, are not adversely impacted in 2020 funding. Allowing temporary interruption of service obligations for our teachers in their payback program, and our professionals, our teacher leaders that are going through the program. And then Secretary authorized to modify any matching share requirements or allowed use of funds at request of grantee for higher education institutions. Next slide. Waivers for the National School Lunch Program. This is a part of the Family First Coronavirus Prevention Act. States may require or request waivers for the National School Lunch Act or the National Child Nutrition Act for the purpose of providing meals and meal supplements during the school closures. Secretary may establish a waiver for all states for the purpose of providing these meals and grant a waiver related to nutritional content of meals. Excuse me, next slide. I want to talk about real quick our next steps legislatively and then programmatically. As everyone has talked about, this is not it. This package does not mean we're done advocating and we're done working with folks on the Hill and working with you all at the local level, looking for an additional $9 billion in funding for school nutrition. We understand that a lot of our students, public schools and bureau-operated schools, provide lunch, breakfast, and sometimes snacks afterwards to our students, and how are they receiving these funds, not just now, but through the summertime. Looking to ensure that connectivity is provided, our Wi-Fi hotspots within the homes, within our libraries, or within the housing communities, locations that our students can get to. And also $1 billion in emergency broadband connectivity fund. This will subsidize broadband access reimbursements for households of 50 or 30 per month based on eligibility. Programmatically, NIEA is working right now to create culturally relevant virtual online resources, not just for teachers or educators to use, but these will be student-friendly and parent-friendly resources that can be used on your smartphone or a tablet. Having cell access might be the only way a lot of our students have any online connection to their school or to any learning applications. And so we're partnering with other Native organizations that are at the local level or regional level to ensure that we're creating culturally relevant, culturally appropriate resources that students can access that are fun, that are maybe projects or activities that the family or a group of students can do together. And be looking for those on our website next week. We'll push them out through social media, and they'll be on in our broadcast. Again, I'm like everyone else, I'm happy to take questions at the end.
Thanks, Diana. Yeah, the key point Diana mentioned is that there's more money that we need to look for. And so what we have created and will disseminate amongst the group later today is a comprehensive spreadsheet that shows what our initial asks were for every line item, what we received, and for those where we received money, what the delta is between what the ask was and what's in the bill and what we didn't receive, so we can kind of get our head around what we need to work on in the future bills and work with our allies on the Hill. I'm going to turn this over to Tony Walters. He's the Executive Director for the American Indian Housing Council, to speak a little bit about what Indian country received on that front in this bill.
Sure. Thanks, Kevin. Thanks, everyone, for joining the call. Thanks to NAFOA for putting this together. And thanks, everyone, for all the work in the last couple of weeks, making sure tribes were included in this package of funding. My name is Tony Walters, the Executive Director of the American Indian Housing Council. I can be pretty brief today. Our housing funding in the bill is pretty straightforward. Under this bill, tribal housing programs can get up to $300 million on top of their annual appropriations. $200 million of that will go directly to the existing Indian Housing Block Grant, which is formula-based. So that should be fairly straightforward and easy for HUD to approve and get out to the tribes' housing programs. Typically, tribal housing programs get $650 million annually, so this is about 30% more than what they would be getting this year. Recipients are the housing programs themselves or the tribally designated housing entities. The other $100 million of the 300 total will be going to the Indian Community Development Block Grant. As you can see on the slide, this program is usually only funded at 65 or 70 million a year, so this is a pretty big jump for this program. The reason for that is because there is some language in the program that allows for some non-competitive imminent threat grants, which are only about 5 million a year, but here we're going to get 100 million for these non-competitive imminent threat grants, and it's supposed to be direct assistance to tribes responding and preparing or preventing COVID-19 in their community. So there's a lot of flexibility there. Eligible entities here are the tribal housing programs themselves or the tribes at a larger sense. So it's a lot more flexibility on what can be done through the ICDBG. I know many of you on the call have accessed that program over the past a bunch of years. So that's pretty much where we are for housing. I saw a couple of questions in the chat box. If there's any homelessness assistance programs that tribes are already have on as part of their housing programs, they can use this funding for that to help with homelessness issues in their communities, or apply for those types of funds through the ICDBG. There was another question about whether or not tribal housing will be included in future stimulus packages related to COVID. We'll certainly be advocating for housing to be included in any funding packages that move forward. We all know that housing is a big driver for tribal economy, so certainly going to keep working to get tribal housing programs included in any package in Congress moving forward. And with that, I'll keep monitoring for questions and take questions at the end. I'll turn it back over to Kevin.
Hey, thanks, Tony. And just for me to wrap up, in our slides, we have our contact points of contact for each of our work group leads. You can I suppose get the PowerPoints after this presentation and has those email addresses. My email's open for any questions, comments, or information. Like I mentioned earlier, it's really important for all of us that are managing these national and regional organizations is to hear from you on what you're experiencing, what your challenges are, so we can work on that and get that into the mix. NCAI also, like most of the other organizations, on our webpage, we have a dedicated COVID-19 webpage that you can go to that Dr. Yvette Rubidoux manages the health side of it, vetting through all of the information on what's real and not real to have pointed information about that. And we'll be rolling out a legislative page to that as well, so you can see what's going on and keep track of that. So with that, I really appreciate everybody's participation and Dante at NAFOA for organizing this. It's valuable. And so Dante, I'm going to turn it back over to you. Thank you very much. And go Canes, go Cane, go Tigers.
Hello?
Yeah, I'm here.
So sorry, I was being respectful and had the phone on mute, but so we're going to go to healthcare. This is the issue that tribes are dealing with now, and I think Stacy has been really active on making sure tribes are included. I think maybe something that's a little different. We're focused on phase 3, but Stacy is knee deep on figuring out how to get the money out to Indian country in the first 2 phases. So Stacy, we'll turn this over to you.
Thank you, Dante. Good afternoon, everyone. And I want to thank you for your time, for investing your time with us today so that we can come to an understanding together of where we are and where we need to go next. I really appreciate it. Do we have the slides?
So just ask us to go next and we'll.
Next
one. So the next one, please.
There we go. Great. Okay, so in phase 1, just a quick wrap up here of the CDC funding for tribes in the first package. We were able to secure $40 million for tribes and tribal organizations under the first supplement, but there was a real problem with the way that it worked because the Centers for Disease Control and Prevention was the entity that received the funding. And we knew, we've worked very closely with CDC for many years. We knew they did not have the appropriate mechanisms to get that money out into Indian country. So the day before this was signed into law, we had a national tribal call led by our leadership, our board of directors, tribal elected leaders, to really try to get at how the tribes want to receive this funding, what their guidance is on the funding and so forth. And from that discussion, which was hundreds of tribes participated in that discussion, it was very clear that they wanted the funding to go to the Indian Health Service, where there are annual funding agreements and where the Indian Self-Determination Act is alive and well, and money can quickly and easily be passed through to the tribes. We were not successful in that effort. We communicated to the secretary the next day, March 7th, and we really demanded an interagency transfer. The letter came from tribal leadership, and we understand that there was a great deal of back and forth at the agency, but in the end of the day, they were not able to get that money out through the Indian Health Service. And I'm sure everyone who's participating on this call has noticed how fraught that discussion has become. And only now, this week, is that money reaching tribes. And there were problems with that as well, which CDC is trying to correct. CDC did hear from the Secretary of Tribal Advisory Committee on March 19th. It was the only time that CDC solicited tribal feedback. The Secretary's Tribal Advisory Committee held fast with the exact messaging that was sent to Secretary Azar 12 days earlier. And at the end of the day, their advice was not heeded. Next slide, please. So in phase one, there was $30 million to regional tribal organizations. This is how the CDC broke this out. 9 regional tribal organizations, Navajo Nation, Chickasaw Nation, and Choctaw. Then an additional $40 million was added. We believe Tom Cole was instrumental in getting that funding out for the tribes. And that is going to go out through non-competitive grants to Title I and Title V tribes. $2 million was identified for the National Indian Health Board to monitor and lead national tribal communications around the COVID healthcare aspects of this outbreak. And $8 million was set aside for the National Council of Urban Indian Health to distribute to the 41 urban Indian programs. And I can't speak to that further, but I can just tell you, NIHB did not ask for that funding. That was something that CDC put out, and our board had approved that that would be okay for us to continue to search for that, search to seek that support for that purpose. Next slide, please. So in phase two, I'm going to ask my colleague and the Director of Congressional Relations for NIHB, Shervin Azami, who's really just been amazing, an amazing and fearless advocate for the tribes throughout this process. Shervin, why don't you take phase two and brief everyone, please.
Happy to. Thank you so much, Stacy. Good afternoon, everyone. Thank you so much for joining us to run through this under the second package. We were successful in securing $64 million in direct funding to the Indian Health Service. That money goes into the IHS services account, and the money is available for all of the different line items within that account. So funding for things like hospitals and health clinics, community health representatives, purchase and referred care, public health nursing, and everything in between. That's what that $64 million is specifically for. In addition to that, the agency, meaning IHS, was able to secure an additional $70 million through the HHS Public Health Emergency Fund. Those were dollars that were appropriated under the first COVID package that IHS was able to secure. And so the total amount of funding that is currently even signed into law and available specifically within IHS for COVID-19 is $134 million. That money is available through September 30th, 2022. And is specifically for COVID-19 related response efforts, prevention, treatment, preparedness, what have you, all within the IHS services account. In addition to funding for being able to secure additional medical supplies, personal protective equipment, and so forth. And you may all have known, and many of you may have participated in a national IHS All Tribes call that was held at the beginning of this week, specifically soliciting the guidance and feedback from tribal leaders as to how the funding should be disseminated. It was pretty uniform that the tribes want the money to come through their annual funding agreements with maximum flexibility so that the tribes as sovereign nations are able to utilize those funds as they see fit to protect and preserve life within their communities. Moving on to the next slide. So right as Congress was finalizing the second package, conversations were beginning in earnest on the third COVID supplement, which is the supplement that the Senate passed last night with a vote of 96-0. It's a $2 trillion package. And as those conversations were beginning, we were receiving feedback and input from lawmakers asking the national Native organizations, asking the tribes, what were the things that were not addressed in either of the first two COVID packages that we need to address as part of the third one? And so knowing that there was only 64 million appropriated under that second package, and there needs to be a much larger influx of funding directly into the Indian health system to go out to all the direct service tribes and go out to all the self-governance tribes so that they can utilize those funds to be able to address the needs within their own communities, both for services, for facilities, sanitation, and everything in between. We worked together and worked directly with the tribes, worked directly with our member organizations, and with our board of directors to request a total of $2.444 billion for the Indian health system. Kind of breaking that down, our request was $1.2 billion specifically for IHS services, another $200 million for IHS facilities, and so on and so forth. Collectively, those things added up to just under $2.5 billion. But then in addition to that, knowing how maximizing revenue streams for healthcare are paramount right now, we were also trying to push forward a package of Medicaid legislative priorities that the tribes have been working on for over a year. These are just technical fixes to federal Medicaid law that will nevertheless have outsized impacts in maximizing third-party revenue. And then we've heard from many, many tribal leaders so far that they're starting to see a lot of their third-party revenues plummet as a result of this pandemic. And so we were pushing very, very hard to get those included. In addition to that, knowing that the CDC has noted that diabetes is one of the biggest risk factors for a more serious COVID-19 illness, and knowing that the Special Diabetes Program for Indians is such a critically important and successful program that unfortunately has been subject to a number of short-term extensions since last year, and knowing that Indian country has disproportionate rates of diabetes, we were pushing hard for a permanent reauthorization of STPI. But in addition to that, we had many allies on Capitol Hill that were pushing for mandatory funding for certain pieces of the IHS budget. For those of you who are part of the tribal budget formulation work group, you know that during the national convening here in DC back in February, all 12 IHS areas voted unanimously to support moving contract support costs and 105L lease expenditures over to mandatory funding. And so we included those requests as part of our priorities, and they were submitted to the Hill. These are national tribal priorities to ensure that the Indian health system and all of Indian country has the resources they need to respond to this emergency. Moving forward to the next slide. So there were a couple of different packages moving forward. There were negotiations between House and Senate leadership, both Republicans and Democrats, working very, very closely with leadership over at the White House. There were some disagreements over several days, and that led to the House kind of introducing its own package while the Senate moved forward with its own package as well. We were pushing forth the exact same priorities across both sides of the aisle, across both chambers. Over on the House side, when the bill was introduced Monday evening, we were able to include several of our legislative priorities in addition to the funding priorities that were already introduced in the Senate package. So kind of going through what some of the funding wins were, and mind you, these funding wins were included in the package the Senate passed last night. That includes $1.032 billion for the IHS services account. That's on top of the money that's already been secured in the first two packages. That money, again, is available throughout every line item in the IHS services account. And there's language in there to ensure that at least half of that money is immediately going out through annual funding agreements to the direct service tribe and the self-governance tribes. But then in addition to that, we were able to secure a new $125 million set aside under the Centers for Disease Control and Prevention for public health in Indian country, all related to COVID-19, everything from infection control to lab equipment to public health services, preparedness, and everything in between. That is the largest pool of set-aside money ever in the history of the CDC's budget. Still, of course, a drop in the bucket compared to CDC's overall enacted budget, but we are happy to see that that money is included. And from what we've heard, again, Congressman Tom Cole was a major champion in including that money. We're always very grateful for his leadership and support. In addition to that, there is a new minimum, and mind you, before I forget, the $125 million under CDC, that's a baseline minimum set aside. So there are definitely opportunities to secure over $125 million for the tribes. In addition to that, there is a new baseline set aside under the Health Resources and Services Administration for health surveillance efforts in Indian country, and a new $15 million set aside under the Substance Abuse and Mental Health Services Administration for addressing mental and behavioral health issues that may have been worsened as a result of this pandemic. In addition to that, the House package included one of the Medicaid priorities within the travel package. That's the 4 walls reimbursement fix. Basically, right now, IHS and travel clinics are largely limited to only receiving Medicaid reimbursement for those services provided within the 4 walls of the clinic. There is a less than elegant workaround for tribes to be able to receive reimbursements outside of the clinics, but sparing the details, knowing that there's such a great need for delivering services where the patients are, going out in the community, setting up mobile units and what have you, again, trying to make sure those reimbursements are maximized. In addition to that, we were able to secure in the House package tribal access to the Public Health Emergency Preparedness Funds. Those are funds that go to all 50 states and all territories, but tribes have been largely left behind. And so that is fixed within the House package. There are some of the other priorities we were also able to secure. Unfortunately, the Senate package did not include those priorities. The funding numbers were maintained, so that over $1 billion I talked about for IHS is set aside under CDC, SAMHSA, and HRSA. Those all were included and were passed last night by the Senate, and we are hoping that it'll be passed soon thereafter by the House tomorrow morning. And as was mentioned earlier, unfortunately, we were not successful in getting that permanent reauthorization for STPI included as part of this third package. There's another short-term extension through November 30th of this year. But as others have mentioned, over the next several weeks, more towards the end of April, there's going to be some movement on a fourth package. And so all of these tribal healthcare priorities that were not included in this third supplement will very much be in play, and we're going to be pushing feverishly to make sure they're included in this fourth package. Moving on to the next slide.
Shervin, just 1 second, please.
Sure.
So on this slide, you see that there's $125 million in tribal set aside to go for through the Centers for Disease Control and Prevention. Good news, bad news. The good news is Tom Cole was instrumental in this too, from his position on the Labor H Appropriations Committee. So we want to do a shout out to Congressman Cole for helping make this happen. But the other side is CDC didn't get this right the first time. We're almost a month into getting the first 40 million set aside for CDC to get to the tribes. The tribes haven't gotten that money yet. So I just spoke with my chairman before this call. Our board is going to be taking a more aggressive stance on this with the White House, with others, to try to find a way to get this funding to the tribes much more expeditiously. And one of the questioners in that Q&A mentioned that CDC didn't even follow its own tribal consultation policy, and that is true. We have an interesting kind of dilemma here. We stand on the ground that when the government made treaties with tribes, it was the entire full faith and confidence of the entire American government that made those treaties and those promises, and therefore the response and responsibility for those promises being kept span across the entire federal government. And when it comes to healthcare, that means healthcare does not begin and end at the doors of the Indian Health Service. So we can look at this a couple of ways. One way is CDC has got to learn how to work with tribes. They are not smooth with this. They are not, they don't have the humility to listen to tribes and act in good faith in a way that the tribes wish to be worked with and adhered to and respected and honored. So we have no choice but to find ourselves at a teachable moment, because we want a long-term relationship with CDC to build public health infrastructure in Indian country. But on the other hand, the tribes need that money very expeditiously, and all the tribes would rather have that money go straight to the Indian Health Service. So it's just something to be thinking about while we move forward with this. Our board is meeting at 2 p.m. I have to get off this call to be on that call, and we're meeting to strategize on how to deal with this specific question. So thank you. Shervin, please continue.
Thank you, Stacy. So again, you know, this slide right here kind of summarizes what we've shared so far in terms of what was included in the package of the Senate passed unanimously last night. From what we've been hearing, the House is convening tomorrow morning at 9 a.m. to begin discussion and hopefully be able to pass this package by voice votes, in which case it would be sent over to the president's desk, and the president has vowed to immediately sign it into law, and we're hoping that it very much ends up being the case, knowing how critical it is to get these relief funds out to Indian country as expeditiously as possible. Moving on to the next slide. So in addition to the tribal specific provisions, I mean, this was quite a behemoth bill. I think we've already shared how it's been the largest relief package in US history. And so there are a lot of provisions in there outside of the tribal specific provisions. But nonetheless, many of those provisions may very well impact healthcare within the Indian health system. For instance, it was over $100 billion for hospitals. There are a lot of provisions in there around telehealth, payment provisions of their Medicare, and so forth. And so NIHB is now in the process of analyzing those provisions to be able to get a better handle on what some of the other opportunities are for Indian country, some of the other funding streams that tribes can apply for and receive, but also how some of these other technical changes around telehealth, volunteer liability protections for healthcare workers, and so forth, how those things will impact the Indian health system. We want to make sure tribal leaders have all the information they need to be able to protect and preserve the lives of their community members. And so we are definitely going to be focusing on this and providing information as our analysis moves forward. Moving on to the next slide. So again, as I mentioned earlier, all the provisions that we were not successful in including in this third package, we're going to be working very closely with our board, our member organizations, and our national tribal partners to ensure that we push these in a unified front for this fourth package. And as I shared, that is still likely several weeks away. I know that as you heard from Senator McSally, senators have already kind of started heading back home for the time being. And we've been hearing that once the House passes this third package, they will also be going back to resuming recess as well. And so there is time to kind of start working together and making sure that all the priorities are aligned and pushed forth collectively for this fourth package. And the next slide. And this is our contact information. And of course, we're also in the process of setting up a COVID-specific information on our website. Please stay tuned and also follow all of our press releases for more timely information around all of the healthcare provisions included for Indian country as part of these packages. Thank you all so much.
Stacy and Shervin, thank you so much for leading the way on the health provisions. It looks like Indian country was definitely included, and we'll look forward to seeing that money get out as quick as possible and working together with you guys on making sure it does. So we're going to jump into our next presenter, Frances Crevier from the National Council of Urban Indian Health. She's the executive director, and I believe she's going to just summarize some of the things that Stacy and Shervin went over and let us know how that applies to the urban Indians in this. So Francis? You might be on mute.
Hello.
We can hear you now.
Hi, so my name is Francis. I'm with the National Council of Urban Indian Health, and I will go through this and just explain a little bit about where the urbans stand. Next slide. So who is NCUIH? We're a nonprofit devoted to the support and development of quality, accessible, and culturally competent healthcare for American Indians, Alaska Native, and urban settings. We were created in 1998 and provide support, technical support to the urban Indian programs and Congress and agencies to make sure that we're not forgetting about our urban brothers and sisters. Next slide. Background, so who are UIOs? UIOs were created with because of tribal advocacy in 1976 for treaty health rights off of the reservation. And more than 70% of American Indians and Alaska Natives live off of the reservation and into urban areas. We do have 41 urban Indian organizations in 22 states. Those programs are primarily funded by IHS and receive less than 1% of the budget, which is about $57 million for 74 facilities. They also don't receive all of the benefits that IHS of sanitation, facilities, CHAP, all those things, and NCUIH is fully supportive of IHS funding for tribes as well as urban Indian organizations. Next. This is just a map to show you where your local urban programs are. If you have any relatives or if you are an urban Indian and you need some assistance, please reach out to our facilities around the area and they will be able to connect you with what you need. Next. The urban Indian programs, they provide primary care, behavioral health services, traditional healing and medicine, and social and community services. It depends on the program you go to, but there's many services that they can provide, and if you don't, they're very community driven and will help you provide the resources you need. Next. For the last year, these are the top 10 tribes that with the highest visits for our programs, including Cherokee Nation, Navajo, Choctaw Nation, Muskogee Creek Nation, Chickasaw, Seminole, Kiowa, and Red Lake Band of Chippewa. Next slide. So IHS is a three-pronged system, and it is the Indian Health Service, tribal, and urbans. And so urbans are a part of the IHS system, and so usually when funding goes through IHS, it goes to tribes as well as urbans as for part of it. Next. So this is essentially all the line items that IHS has, and this is a lot of what all of our partners here have been working hard on to ensure that all of the services are taken care of. Next. So the impacts, we've done a survey on our urban Indian programs, and the impacts we've seen so far is 100% of respondents have had to reduce their hours. 71% our staff have begun teleworking, and 3 programs have actually been able to open drive-through clinics. And so we're still trying to finalize that survey, but we are watching how this pandemic is facing all of Indian country. Next. So Shervin and Stacy very eloquently discussed all the funding that is being received. And so out of that funding, the minimum of $40 million is going to tribes, tribal organizations, and UIOs. All of us pushed to do an interagency agreement where CDC was going to do an interagency agreement with IHS. But after much discussion, and we're not quite sure, CDC decided they were going to use our cooperative agreement as well as others to get funding out. And so CDC announced that they would disperse over $80 million to Indian country, which we are still waiting on. The January 20th, there is language in that bill that would allow for reimbursement from January 20th to March 6th. And we're still waiting for a little bit more information on that. But 90%, which is about 70 million, will be going to tribes, and 10% will be going to urban Indian organizations. Next slide. So 64 million, as Shervin said, will be going to testing, diagnostic testing for COVID-19, as well as the no cost sharing, which most we already don't have that. And then $70 million will also be going to IHS ITU. So it'll go to all of the IHS tribal and urban programs for supplemental emergency funds to prevent, prepare for, or respond to the coronavirus. Next. The funding that I wanted to point out is it will be that the 1.032 billion will be available until September 2021. And that includes a lot of different funding, as you see here, all for the ITU system, SDPI as well, and as well as SAMHSA and all the NCDC as well. That will all be for the ITU system. Next. So I just wanted to do a little bit of a deeper dive on the 1.032 billion. So what does it mean to prevent, prepare, and respond? So it includes, in the bill language, it includes public health support, electronic health record modernization, telehealth and other information technology upgrades. So if you are needing laptops or anything that's going to help you with telehealth, the funding will be for that. Purchase and referred care, which tribes are eligible for and urbans are not. The Catastrophic Health Emergency Fund, Urban Indian Organizations, which is the line item that urbans are funded under, tribal epidemiology centers, community health representatives, and other activities to protect the safety and patients and staff. Next. If you have any questions, please email me. We do have a COVID-19@ncui.org email if you have any general questions. If you are looking for resources on how to get your family member or yourself into get some help, especially with this epidemic, please reach out to our website or email us. And we do have a website with resources, information, as well as a coronavirus legislative tracker. Thank you so much.
Okay, thank you, Francis. And in the interest of time, we're going to switch quickly to economic development. And thank you all for bearing with us. There's an awful lot in the bill, and there's a lot out here that we need to get out to tribal leaders. So on the economic front, we want to be able to talk through the major provisions, which I think are condensed into a few different key components of the bill. And then we also want to bring in Jason Giles and Joe Valandra to talk about how that impacts their communities, their constituencies on the gaming side and on the contractor side or small business side. So just looking at the SBA loans and grants program. So next slide. The SBA loans and grants program. So on the Q&A that we're seeing come up on the screen here, there's an awful lot of questions on this program. So there's a few different pools of money that we're looking at here. And I think it's worth noting that on the tribal leadership, we're separating, the funding that might be available through the Corona Relief Fund for tribal governments, the increased funding for BIA into the TPA program, and those government services. The second part of this is really looking at small businesses. So if you're thinking about this and looking at your enterprises or the other businesses, related businesses, you want to look at how they qualify for the SBA program first. And in this program, we have a total of 350 billion or close to it that's going to be available for loans to any entities that are under 500 and also meet the size standards for the SBA. You can check online at the SBA site to see how you qualify. So the loan forgiveness program has a couple of key components to it. As long as you're meeting that 500 employees or less and the revenue requirements, any tribal business concern is eligible. And this is one of those terms that is not defined in here. It's designed to be open So the assumption is that any business concern, including a tribal business concern, is eligible. The loans can cover things like payroll costs, salaries, benefits, interest, mortgage, rent, debt that you had before the virus. And there's also a $10 million limit on the single loan amount that you're allowed to apply for. And those losses are going to be, you can apply for those covered losses in the form of a loan from February 15th through December 31st. And a key part of this is that they're 100% guaranteed. So this is an increase for those SBA programs. There's also fees that are waived. I think there's reimbursement to the banks that are taking this up, but for the applicants, there's not going to be fees for those loans. The loans are directly from the lender. It's not coming through the SBA in this case, through the administrator, like a different program. So you go to your bank, you get the loan, it's 100% guarantee, and there are fees waived. There's an interesting part to this that additional lenders can be determined by the administrator of the SBA. So in that sentence, it really means that we should be advocating that CDFIs and other programs should be included in that kind of, for getting money out and having those entities lend to Indian country. So the forgiveness program will cover things like payroll, mortgage, and rent to get forgiveness of the loan. So you apply for the loan for some of these losses. If you're keeping your employees on, that's great. You'll get forgiveness of that loan if you keep paying those expenses. So this is a loan that can be turned into a partial grant. It's not clear that all of the eligibility for the loan purposes are also included in the forgiveness, but it is the majority. If you look at payroll and rent, that's a pretty big part of it for that forgiveness part of the loan. So that is the first place to go for funding from this if you're a business concern, tribal business concern, to go for funding. The other part of this is, next slide, is on the Economic Stabilization Fund. And on the Economic Stabilization Fund, or actually, sorry, we'll come back to unemployment in a second, but on the Economic Stabilization Fund, this is a different and very interesting piece of this legislation. There's a total of $500 billion that are available for states and distressed businesses. Tribes are included in the definition of states. So they're eligible for anything that the states are eligible for. They're also eligible for anything the businesses are eligible for if you have tribally owned entities that do not qualify for the 500 or less employees. There is no loan forgiveness in this program. So obviously for your smaller businesses under 500 employees, you want to go to the SBA loan pool first. This is designed more of a credit relief program. The Federal Reserve, since it can't carry any losses on its books, the Stabilization Fund establishes $500 billion at Treasury to back the aid provided by the Federal Reserve Bank. So this also means that the fund will be leveraged at about 10-to-1, possibly more. So it makes it a $5 trillion fund potentially that's available for business relief. There's going to be a lot of people applying for this. So what happens in this fund is that the Federal Reserve Bank can purchase obligations directly from issuers, so bonds and banknotes. They can purchase obligations on the secondary market. Again, that's bonds for any tribes that may have raised that debt in the past in that way. But it also can make direct loans and loan guarantees available. And that's the important part for tribes. So direct loans, there's no bank in the middle. This is direct loans right from the Federal Reserve that's given that lending authority in this provision. So the rates are determined by the Secretary of Treasury, and they're based on the risk in outstanding marketable treasuries of comparable maturity. So what that means is, at most, they're going to be 5-year loans, and which means at most they're going to be based on the current rates of the 5-year Treasury, which is pretty low at this point, well under 1%. There's a 10-day turnaround on these rules, which means we have to get pretty active on engaging with the Federal Reserve Bank on things like what are the collateral requirements and how are tribes going to be included in a separate class. There's also, for just FYI, there's a limitation on salary of $425,000. You can't buy stock back, and those other things that the Democrats were advocating for at the last minute to get some safeguards on the use of this money. And there's also full exposure to the applicants on taking the money and how that loan works out. So for the tribes that have significant operations, this is a viable loan fund for getting direct loans from the Federal Reserve Bank. Not on the government side, but on the business side of things, it is also available for governments as long as there's two pools of money or two forms of eligibility that tribes are involved in. So again, the rules on this, on who can participate, are pretty flexible. We'll take some questions on this in a little while. This is going to be interesting on how the rules are set up, but just know that the Federal Reserve Bank has a lot of flexibility on what they do with this money. And just going over the payroll or unemployment insurance, if we can go to that slide, it allows for reimbursements of up to 50% of the incurred unemployment benefits through December 31st of 2020. So tribes are stuck with the other 50%, which can be relieved through the Coronavirus Relief Fund. That $8 billion has been appropriated, that's unanticipated expenses, or maybe some of the other programs. So we'll have to figure out how to get creative in funding that unemployment for tribal governments. Next slide. So on the Coronavirus Relief Fund, the $8 billion that's available for tribes in this case, that's housed at the Department of Treasury. The Department of Interior is coming up with the rules for that, but it's really designed to be flexible, although there is some concern about the rules that are going to be made around this for what can constitute expenses due to the coronavirus. So we'll be working on that. But I think, I'm not sure if we have a slide on planning for tribal governments, or that may be a little bit later. So with that, explaining the main provisions for businesses on the SBA program and on the larger relief fund, I want to turn it over to Jason or Joe Valandra, if you're on the phone, Joe.
Yes, I'm here.
Great. Can we cue up Joe's slides then?
I don't think I really sent any slides in because everything happened so late last night. So I'd just like to cover one thing. And Dante, there was a provision under Title IV, Section 4003 CD3, assistance to mid-sized businesses that is employees with 500 to 10,000 employees. It defines covered loss as includes losses incurred directly or indirectly as a result of coronavirus as determined by the Secretary, and then some other lists of criteria. But it says that eligible businesses are those that are in the United States and not otherwise have received adequate economic relief from the forms of loans or loan guarantees provided under the Act. So we haven't spent a lot of time talking about that, and it's something that is in the Act that I think should be looked at. I think it's another alternative through the stabilization fund for larger tribal businesses to access other kinds of loans and financial assistance through that fund. So I think that's something that we didn't focus on before, but that I think we should put on our list to focus on going forward. And I just want to say, as the executive director of the Native American Contractors Association, our key focus is to make sure that tribal enterprises and Native contractors, get equal access to all of the provisions in the I almost said the Recovery Act, in the Coronavirus Act. And one provision that specifically helps federal contractors is Section 3610. It's entitled Federal Contractor Authority. And what that does is it gives the contracting agents that are dealing with current federal contracts with all contractors, but in particular Native American contractors, the ability to continue to pay or to modify the contract so that the contractor is reimbursed for unemployment, for keeping people employed, for billable rates not to exceed 40 hours a week, including paid leave, including sick leave, so long as to keep the employers or some subcontractors in a ready state. I think that's something that, again, anyone on the call who is a federal contractor can get a hold of their contracting agent, and it says that this modification to contract is made without consideration. So it's pretty much automatic. I think I'll stop there because I know Jason probably has a lot of other things to talk about, and there have been a lot of questions on the question and answer board about the impact on gaming.
Yeah, Joe, thank you very much. This is Jason Giles. I hope you can hear me. Can you hear me, Dante?
Sure can. Thanks, Jason.
Okay. Thank you for everybody, and what great information today. And actually, Joe, I know NCAI has got an important call at 2:30 coming up, and I just want to pass along a couple of things from Chairman Stevens and from our NIGA board. First of all, to the best of our knowledge, all the tribal casinos are now closed down. There may be some open that are providing assistance and relief, and that's why they haven't, that's why you're hearing maybe some are still open. But to the best of our knowledge, the casinos have heeded the warnings of public health officials and have closed their doors. Also, to the best of our knowledge, a lot of tribes are paying their employees through March 30th, through next Monday, and some are even extending that out to April 10th. Beyond that, though, it's going to get tight. And while Dante brought up the $8 billion relief fund, one of the things we're going to have to do and be creative about is how tribes can structure their requests to the Treasury that will meet the 3 criteria. Necessary expenditures for COVID-19 was not in the tribal budget for this year, and also was incurred starting March 1st to December 30th of this year. And the most important thing I'm going to tell you on this call is, right now, National Indian Gaming Association, we are working on providing tribes with guidance on how to structure a program or programs so that it can meet the eligibility criteria of this coronavirus relief fund, the $8 billion. Now, what are we looking at? We're looking at the Tribal General Welfare Exclusion Act, and we're looking at all the IRS opinions and rulings under that act, because that's our model. We fought hard for that to get the IRS off our back, because these were essential government functions. This is an essential government function. So we need tribes to be creative along with us, and we're going to be out there recommending different kind of programs that can meet these 3 criteria. And if you just think about it, if a tribe has to take over paying for elderly people's, whether it's air conditioning or heating, there's still winter in a lot of places, just set up a program and call it the Coronavirus Assistance, Elderly Assistance Program, things of that nature. And we can start to get funds flowing to the tribal governments to take care of our people. That is where the cooperation of all these organizations can come in and help us devise programs to meet these criteria. The federal government, this is a historic $8 billion. We were left out of the Recovery Act in 2008, 2009, left out of the tax bill of 2017, and now we have a fund, and we have a tribal tax advisory committee, tribal treasury advisory committee that can assist us throughout this process as well. So we're going to be leaning on a lot of folks, and this is going to happen within the next 30 days of whenever the Treasury gets the regs out and when the bill is finally signed by the president. It's unclear when the clock will start ticking, but we're just going to have to get it up and running and get your requests in. And it's going to be a scramble. And oh, by the way, the virus is still spreading and it may come to your community in the meantime. But I really want to just thank all the organizations out there for the work you've done on the healthcare aspect of it. We're at NIGA working very hard on this because we know the direct impact on the jobs. You'll see the 2019 economic impact that was supposed to be distributed at our trade show this week in San Diego. It's not happening. We're going to get this report out there, but it's just a baseline to show how bad things have gotten in just a matter of weeks. And we're going to ask the NIGC to help us collect the economic impact of what our casinos are experiencing, and more importantly, what our workers are experiencing. And you're going to see tribal employers. We're not going to ditch you like Marriott's and Hilton's and all these big guys that are already cutting tens of thousands of jobs. We're trying to hold on to our employees. And I think that's what this is all about, is making sure people can fight the virus and not have to worry about making bill payments for the next couple of months. So let's not lose focus on that. And let's not lose focus that, you know, National Gaming Association, we're defending the casino industry, but our time will come in the months ahead. Right now, this is the healthcare and public health crisis, and we're here to assist as we can. So thank you again for everybody, and we'll be there for you as we try to get back to normal and try to get businesses back up and running. So thank you, NAFOA. Thank you, Kevin Alice, for doing this today.
Okay, yeah, and thank you, Jason, for the partnership and working through all this. This has been good, and Joe Valandra as well, National Center for Indian Country Development. So we've been working together on the economic impacts of this. So I do want to just, we're going to open it up to questions. I know NCAI has a meeting coming up, but we're going to stay in this for as long as we can. I know this is really important to start planning these things. So we do have a couple of people that want to answer some questions that have come up. I see from a lot of the economic or business questions, there's a few questions that go to, you know, how are we eligible and how are we applying? So the are we eligible question on the main pools of money, just to repeat, it is open. We were really consistent in asking for this to remain as open as it can be. So we want to have the idea that the language says any business concern for the SBA language, or any business in the Economic Stabilization Fund or the other component, those are open. So if you're asking about whether or not it's all your employees or some of your employees, that's a decision that your tribe is going to have to make. If it makes sense to keep your contractors in that bucket and go to the SBA, that's it. There's going to be more coming out about this. I know there's a question on exactly what the loan forgiveness is. I think we're going to be waiting on SBA to determine a lot of this, because in the legislation, the eligibility for the loan funds is a little bit different from the eligibility for loan forgiveness. It is a $10 million total loan that you can get for any one applicant. The loan forgiveness may be a little bit different from that. So we've been trying to jump in and pay attention to the different versions of the bill and the things that are moving around. So the next phase will be trying to get more information out, which is going to be really important. Just in stressing your planning on this, look at the tribal government concerns and the funds that are available for that. Look at your smaller business and mid-sized business concerns and your larger business concerns, and try to start planning out how you're going to approach this from the different provisions in there. The idea is that tribes should get as much relief as possible in this. Our tribes are very vulnerable in this whole coronavirus issue, because we do have the healthcare needs, which we need to take care of right away and get money out. But we also have tribes that are involved in the vulnerable businesses. So like we said before, the oil prices have tanked, the gaming industry, the hospitality industry, the tourism industry. All of those core components would probably make up about 60% of the tribal economy, have been hit really hard. So our goal in this is to open as many of these things as possible with the assumption that you're going to be included. If there is any issues that come up, we'll ask you to reach out to us or NIGA or NACA, and we can try to address these issues together. I'm sure we're all open to doing that. So let me just go over to a couple of questions. Lucina is going to open up some questions. So if you raise your hand, and I think there may be somebody from the Congresswoman staff that's still on the phone that wants to answer some questions now. So Lucina, I'll turn this over to you to see if we can get some questions and have some of the panelists answer these questions.
Great, thank you, Dante. Just to go over how this is operating, if you are on Zoom, you should be able to see an option to raise your hand by your name. All participants are currently muted, but we will unmute you when you're asking your question. But double check you are yourself unmuted on Zoom by looking to the left of your screen. You should see a microphone button. Just make sure that says unmute. If you're on your phone, just press *9 to raise your hand and make sure that you are unmuted by the phone function or pressing *6. And okay, we have some hands going up. Let me see what we have first. Okay, I'm going to call on Roxanne Brown to ask their question. Roxanne, you are now unmuted. Please go ahead.
And just a reminder, you might have to unmute your own phone.
Yes, if you're on your phone, please press *6 to unmute or look at your phone's unmute function. And Roxanne Brown, you are on.
Okay, I am getting off. Thank you. I'm on another webinar and somehow this one popped up again. Sorry.
No worries. In that case, I am going to go right to Vivian Arandulas. You are now allowed to talk. Please ask your question. Vivian, you're on.
I didn't have any questions.
Okay.
Sorry.
No worries. And I see that we have Hermina Frias has raised their hand. Hermina, you are now allowed to talk.
Good afternoon, good morning. I'm in Arizona, Herminia Frias, Pascua Yaqui Tribal Council. Can you hear me?
We can hear you.
Oh, I just wanted to take the time to thank Senator McSally for all of her work that she did on her advocating and the tireless work that she did do to get that funding for the tribes throughout the nation, not only for Arizona, but we did hear from other senators and from people at the White House that it was really a lot of work and a lot of effort. And I just want you to know, Senator, that we do appreciate it. This is, we've heard this time and time again that this is an unprecedented time, and it is. And so every advocate that we can get in Washington, D.C., we need. So we do appreciate it, and we'll be reaching out. I know you're, coming back to Arizona, or you're here already, and how we can really focus on, boots on the ground, especially when it comes to these test kits, and making sure that we get those out to the reservation out here in Pascua Yaqui, so that we get those on a timely basis, and we mitigate the COVID spread. COVID-19. So thank you, and I appreciate the opportunity to speak today on behalf of Pascua Yaqui Tribe.
Thank you.
Okay, thank you so much. We're going to go ahead to another question. I see that Melissa Reardon has raised their hand. Melissa, I'm going to open up your line now.
Good afternoon, everyone. Can you hear me?
Yes, we can.
Okay, great. Again, thanks to everyone who put all the work into securing the funding, and also to all of you who coordinated the call today. Greatly appreciated. My question pertains to the phase 1 funding, and we did have a sideline chat that was communicated, so I just wanted to verify. For phase 1 funding regarding the monies that were put forward for the Title I and Title V tribal nations, it indicates that there's those funds are going to tribal nations who have populations that are 40,000 people or more, and then also have the tribal public health capacity building and quality improvement cooperative agreements already in place. That is terrific for those tribal nations that qualify. However, I'm in an area that our tribal nations population is much smaller and we don't have those agreements in place. So are there other funds that are going to become available for the smaller tribal nations? And I work with tribal nations in the Great Plains area. Thank you.
Shervin or Stacy, if you're still on the call.
So Dante, this is Kevin. The only information I have on that, and Stacy did reference the delay and how long this has taken to get some of these phase 1, phase 2 dollars out. But we learned yesterday through a conference that Chairman Grijalva had with the Director of Indian Health Services, and it was mentioned that the $40 million that's in, I believe it's that first piece of legislation, there's going to be a funding opportunity made published this week. I have no idea what the criteria are going to be in that, but the delay apparently is coming to an end, and they figured out logistically what they needed to do to get the money out to Indian country. And he announced that funding opportunity for that $40 million was going to be made available this week. That's all the information I have on that.
Thank you, Kevin. We do have one person holding up their hand who is on their phone. The number is 541-591-2758. If you end with 2758, I'm going to allow you to talk now. Your phone is now open.
Hi, can you hear me?
Yes, we can.
All right. So on the eligibility for the fewer than 500 employees, if we have a development corporation organized under Section 17, but then we have other LLCs organized underneath that Section 17, is that 500 employee limit for the entire Section 17 or for the individual companies?
Hello, this is Joe Valandra. The way that we're currently reading the law, and I have to caution you that some of this is still has to be sorted out, but because the law says tribe or tribal entity, it would be a common sense reading, and there was some guidance in one of the commentaries over the course of the week that individual subsidiaries that have 500 employees or less could apply individually. So my reading at the current time is, and I have to couch it that way, is that each entity can be treated separately for loan purposes, and probably should be looked at that way as you're planning to do whatever you need to do.
Right, and just to, we do need to work out some clarifications, but the idea is that tribes set up multiple businesses under different structures, and those entities should be eligible as long as they meet the requirements. So we will definitely be working with SBA to clarify that.
We have Cheryl Andrews is up next. Cheryl, I'm going to allow you to talk. Please go ahead and ask your question. Cheryl, if you can unmute your mic and ask your question.
Can you hear me now?
Yes.
I apologize for that. I wanted to thank everybody for putting this on. This has been very informative, and for all the hard work of getting the legislation pushed through as it is. I just had a couple of questions. This is Cheryl Andrews Maltese from the Wampanoag Tribe of Gayheadaquina, and I'm the chairwoman. And I was wondering whether or not the funding that is coming out will be available for running our tribal government, specifically for paying the stipends of our tribal council. And with regard to the health, I was hoping or wondering whether or not we would be able to get access to the self-testing and additional, because that would be more appropriate for our tribal community. We also want to know whether or not contractors that were working for the tribe, specifically underneath our tribal entities like a historic office, would be able to take advantage of being considered part of the small business forgivable loans, or whether that could fall underneath something else, because these people are doing vital work for our community. However, the work is drying up. We're underneath a stay-at-home in our entire state and on the island, and these people are losing their revenue and potentially losing out on being able to pay their rents or their mortgages. Thank you.
So I'm not sure if Kevin wants to jump in, but I think I think you're in an interesting situation where we're seeing some things in the news on Narragansett and some of the other islands where people are leaving New York City and kind of going to their second homes on the islands, and it creates a burden for you in your community. So best wishes on working that out. I think on the question on government funding for stipends, really the fund again is open, but as long as you're looking at this as the losses that have been impacted, that's government fundings, the losses that are impacted from the coronavirus, hopefully will fall into that $8 billion bucket that we have for distribution from Department of Treasury through Interior. And there's other funds that you might be having access to for some of the contractors, or maybe at least advising the contractors. The business funding it's an important note. It's not just for the incorporated businesses, but it is also for self-employed. So if you have contractors that are self-employed, and this is relatively new, they opened this up. So self-employed people can also apply for that business loans to keep them afloat, and hopefully look for forgiveness in that program for some of the core expenses. And I'm not sure if I can answer the healthcare questions, or anyone else has anything to add to that.
Hi, this is Trevor Pearson with Senator McSally's office. I just wanted to know also that there is an increase in the tribal priority allocation account, $453 million. Now, the exact amount that eventually makes it down to tribes, of course, will be different for everyone. But that's another flexible account that will hopefully be useful for government operations. By the time that gets out to tribes, of course, that number may be fairly small, but just wanted to note that that's a separate funding stream to be looking at as well.
Yeah, that's great. Hey, this is Kevin, NCAI. Chairwoman, these are great questions. Some of the answers are we're not going to be able to answer, because it's going to fall on the agency to interpret and develop what that is, and that's why our next process that we have this call, it begins at 2:30 actually with the work group, is to begin to strategize on how we make sure these agencies, whether it be Treasury, whether it be Indian Affairs, whether it be SBA or wherever, understand, all the needs that need to be addressed here, so tribes can get the most relief possible. Jason Giles, did mention the $8 billion, and the language is not perfect, but there is a wiggle room there to work with the. You hear my dog crying in the background, because we're all working from home and dealing with these things normally I don't have to work with, and she's going nuts because I've been on the phone for a while. But anyway, we have to make sure that these agencies interpret the language broadly enough in a way that makes these funds valuable.
Yeah, Chairwoman, this is Jason Giles again. I really encourage you to look at that coronavirus relief fund for tribes, because one thing they have given us is a start date, March 1st, 2020. So for other tribes on the call and your tribe, just start labeling your expenses coronavirus expenditures, and everything from March 1st forward, start keeping track of that in a separate pile. And you can start to sort that out as these Treasury regulations come out. But it's important. They gave us a start date, March 1st. So any expenditures from now on, like you mentioned, people have rents coming due. That's the perfect kind of program that if you developed it under the Tribal General Welfare Exclusion Act, is an essential governmental function. So people need help paying rent. They're staying home and trying to prevent the spread of this virus. That's a coronavirus expenditure. So I would use that start date, March 1st, to start labeling everything.
And just piggyback on what Jason's saying, it's such a great point. Just because we have to point out what the language in that provision says. The language, just to be clear, and it's no secret, everybody can read the bill language, is that the $8 billion can be used for, and it says only for costs that are essentially, are necessarily, they're essential as a result of COVID-19 and were unbudgeted. Okay, these are unbudgeted necessary expenditures to address COVID-19 that happen in that time frame Jason mentioned, March 1st to the end of the year. So Jason's point, we're going to have to consult legal counsel if you have it, and you're the people you rely upon. But programs that come online today to provide essential government services, would be, you didn't expect it to happen. It's not budgeted. When you were putting your budget together last fall, you didn't expect this pandemic to be around here in the spring. And so creating these programs and labeling it like Jason, kind of sets up for a good scenario.
Okay, we're going to take one more question. I know people have to jump off for other calls. So Lucina, one more.
Okay, the next person we have is a phone that is dialing in. That is number 136-07-89-6655. I am going to allow you to talk. Your line is open. Once again, that's number ending in 6655. Your line is open.
Yes, can you hear me?
Yes, we can.
Okay. Yeah, I had a question on the Federal Reserve and the loans that will be available directly to tribes. Is that going to be in the form of a proposal put forth by tribes, or will they have a formal application process? Did you hear that?
So I'm sorry, can you repeat the last part then? Does it have to be a formal process?
Yes. In regards to the loans that tribes will be able to access directly from the Federal Reserve, will that be an application, or will it be in the form of a proposal from the tribe?
So that's the big mystery right now. The legislation really lacks a lot of details, and I think they're doing that on purpose. They're going to be looking. The Federal Reserve Bank is working right now to make the rules around this, which is why we're trying to get their attention now. So they're going to. So the thing that we're concerned about on collateral requirements is if they hold us to the same collateral requirements or use land or different assets as a basis for that, we're afraid we're going to get left out. It's a huge fund of money that we need to participate in. The other parts of it that you're asking specifically what are the other, what's the application look like? Are we going to have to submit a proposal? Most of this is going to be based on losses and getting by for a certain period of time, which is why it's a maximum of a 5-year period and very low interest rates. So they're going to want to get the money out pretty quickly. To prepare for that, they're going to probably set some parameters on the type of debt that they're willing to take risks on for the majority of that fund, which is another reason we have to look to getting into a different place. So if they are looking at, for example, in the first round, investment grade debt, well, a lot of tribes don't have their debt rated, so we're not going to be able to participate in that round. So we need to be engaging with Treasury and the Federal Reserve on this. The idea that they're submitting a proposal or a plan, they're looking at just, again, it's not really new financing that they're trying to do for this, but basically helping all of these businesses and governments with their credit needs and the capital needs right now for the next 5-6 months on this. So it's really important to try to get engaged quickly, and any communication on your part to help us really set the parameters on this would be appreciated. We know that there's a huge need for the gaming side of this, oil and gas, and some of the other large entities for Indian tribes. So we want to be able to participate in that. So any help you can give us. The application process is going to really depend on whatever the Fed comes up with in the next. There's a requirement for 10 days after passage, which the clock will start to tick likely tomorrow or after the president signs it. If that is tomorrow, we have 10 days to really make the rules and start getting the money out. Secretary Mnuchin committed to that, and I believe it's in the legislation. So, so I hope that answers your question.
This is Trevor with the Senator's office. I just wanted to give a general comment there on this issue specifically and these provisions in general. We are quickly going to be shifting gears in our office to our work with the administration on the implementation guidelines to make sure that they are implemented in a way that works for tribes, especially on this $8 billion fund, the SBA loans, the larger loans, to make sure that they're consulting with tribes as they come up with their implementation guidelines, and they're using the flexibility in the text to be helpful. It's the whole point of this is to be helpful. A lot of these accounts have rules that this money has to be spent by the end of the year, the end of the fiscal year, so that there's no reason for them to hold on to this money. You know, the government is supposed to spend this money, so we want to make sure it gets out to tribes where it's needed. So we appreciate any feedback from the national organizations or our local tribes on how best we can engage with the administration to make sure that these things are useful.
So Trevor, we are going to rely on you to help us on that. And we also have Casey Lozar from the Minneapolis Federal Reserve, their Center for Indian Country Development. We'll be reaching out to him as well. And one other comment that's been crossing some of the questions and how we're going to manage this going forward is the collection of data. So we're also looking to work with the Center of Indian Country Development for what data we need to collect. And we are going to need to collect data in this for what might happen in phase 4 or other issues that can arise going forward, so that we can be better prepared for anything else that happens going forward. So with that, I know people have had to leave the call. We had well over 1,000 people on this call, so Indian Country is very interested on all of the different provisions here. We're going to continue to work and pull out summaries from our different organizations in our respective areas. And stay tuned on the implementation. It's going to be a really important part. And thanks for all those people in the field who are helping, everything from the Chamber of Commerce in California, who's been working with the state government, to all the different CDFI funds and everyone for submitting their comments. So we're really excited at the idea that we're all working together here at a frenetic pace in DC, and the intertribals are involved, and all the different representatives from the tribes. Keep the comments coming, and thank you for all the panelists for being willing to jump on the call and answer questions. And let's just keep this dialogue open. We're all in this together, and I want to wish everybody good health and well-being as we work through all of this together. So thanks again. Have a great rest of the day, and we'll have more of these as more information comes out. Thank you.
Thank you, Dante.
Thank you all again for joining today's Tribal Leader Town Hall. This has been recorded and will be available at the end of the day. Slides will also be sent out and available, and we will be taking care of the questions that we received and making sure folks are receiving the answers as well. Thank you all again.